Okay, so today we're covering two body systems. We're going to work through the sensory organs and the endocrine system. So we're covering a lot of different parts of the body, but we're going to focus on just a few major case examples, and then we're going to have a little taste experiment as well. So as per usual, your goals are to understand what are the botanical sources used in the treatment of these organ system issues. For the sensory organs, we're going to start by focusing on problems of the eye. So we're talking about glaucoma, ocular inflammation, uveitis, and infections, as well as ear infections. And then we're going to go on to some of the issues with the endocrine system, thinking about hypoglacyaemics, therapeutics for diabetes or for pre-diabetes prevention, phytoestrogen, and then we're going to get into that murky category of weight loss. Remember, many of these botanical cures, we had an example somebody brought up this morning. Many cases, if you have a claim where they promise to basically have quick weight loss or fast-acting kind of activities like that, those are usually overreaches. There are no plants that I know of that can both cure your cancer, make you lose weight, make your memory better, all the wish list of like longevity. There's nothing that can achieve all of those, so just keep that in mind. All right, so for our botanicals to know for your note cards, are you all keeping up with your index cards? Okay. So we've got some of the Orabancaceae. We haven't really talked so much about the Orabancaceae so far, but these are two Euphrasia species. These are both in the genus Euphrasia, and really I think this might be the only genus in this family that we'll discuss in class. This is known also as eyebright, because we're seeing the name of that in some bottles. We're going to talk a bit about Chamomile Asteraceae, also used for what conditions? Besides the eye, we've talked about it's rich in tannins, good for kind of tightening pores. We're going to talk about some very poisonous plants that are used to treat glaucoma. We have Pilocarpus species and Physostigma. Venenosum, that, is a giveaway. It's venomous, or not venomous, but toxic. You have the treatment of anterior uveitis with Atropa belladonna in the deadly nightshade family. Belladonna has also been used for treating ocular pressure. Erythroxylum coca in the Erythroxaceae family, which we have therapies for excessive cerumen, that means earwax. So these are oils in most cases of these plants that are added to the ear canal to help soften the wax. So you have Pruinus amygdalis in the Rosaceae family. Anybody know that one? Starts with an A, almond. And we have Olea europaea, olive oil, okay? Ear infections, there are a lot of different plants that are instilled into the ear, typically in a base olive oil. And then we have treatment of irritation of the orthopharynx using some of the plants that we discussed in our respiratory lecture, which contain which compound? Menthol and some of these other aromatic compounds in the mint family. So let's start by first thinking about the structure and function of the eye. So we see just, the eye, you have the white of the eye, the pupil, the iris, the lacrimal glands. This is how you cry, right? And then we have another lacrimal canal here as well. And this is also connected to your nasal area. What's interesting about tears, and if you look at this, does anybody know what this is? This is a plate of microbes, of bacteria, and you can see that tears actually have some antimicrobial properties. So there is an enzyme called lysozyme that you find naturally in your tears that helps to ward off microbial infection. Now, how many of you have heard of this idea of conjunctivitis or pink eye? Anybody had pink eye? I've had it before. There are different forms of pink eye that you can get. So you have pink eye from irritation of the eye, You can have pink eye from being exposed to particles in the air. You can also have pink eye due to viral infections, or you can have bacterial infections. And typically when you have pink eye due to bacterial infection, you get a kind of a discharge that's associated with that. So what plants are used to treat conjunctivitis or eye inflammation? We mentioned again from the Orobanchaceae family, you have Euphrasia species, eye bright, and you can find this in stores marketed as eye bright. The way that it is used is typically you'll place it onto like a cotton swab or a cotton ball and kind of rub it around the eye. There are a number of different iridoid glycosides present, also some tannins. There is a long history of use in European herbalism for this plant. They've found that also the use of eye drops have been useful for treating conjunctivitis. So you can apply it either by kind of rubbing it around the eye with a soap and a cotton ball or actual installation into the eye through eye drops. Another plant that's been used to treat conjunctivitis is that of Chamomile Asteraceae or witch hazel. Now, witch hazel is typically made by boiling the material in water and making a tea, and that tea is very rich in tannins. That is the part that you can use to put into the eye. The tannins that it has are these gallotannins. You can take the partially dried twigs that can be macerated in water or boiled in water to use them as eye drops or kind of eye lotion. It can also help to kind of tighten up skin around the eye and help reduce some of the redness. This is one I've seen actually used for the treatment of conjunctivitis in the Mediterranean. They also use this to soothe irritated skin in other parts of the body, especially in infants that have diaper rash. So for chamomile, though, here we're using warm teas or compresses. And so the way this is applied again is, and just having something that's like a cloth, a soft cloth that's been soaked in one of these teas, then applied as a compress. You're not rubbing, you're just applying on top of the eye. Or you can use it again with the cotton ball, kind of wipe around to clean the eye. This is used to help also remove the pus and grime, especially with a bacterial eye infection. And is safe again, with the exception if you have daisy allergies. Okay. Now let's talk about another condition of the eye. This is glaucoma. Glaucoma occurs when you have increased intraocular pressure, and it can cause blindness if it goes untreated. And so here's an example of an interesting alkaloid that can be used to treat glaucoma. It comes from a plant. There are a number of species that it can come from, but Pilocarpus is the genus that you find it coming from. It works, and we're going to get more into these different cholinergic and anticholinergic receptor sites in our last lecture on the musculoskeletal system. But this works by mimicking acetylcholine. It acts as a miotic, meaning it constricts the pupil. So if you think about when your pupils are dilated or constricted, this helps to constrict the pupil. It can help to reduce the pressure within the eye. Now, if you take it systematically, again, I did mention this is a poisonous plant. It can cause some of those sludge toxidrome effects that we discussed in our poisons lecture. You get excessive salivation and also tachycardia. Used properly can be quite safe. Here's another example of one that can be used in a similar way. This is Physostigmine from Physostigma venenosum. But again, poisons and medicines often share a very fine related line. And in this case, it also acts as a miotic, so constricting the pupil and helps to reduce the pressure. The main difference between physostigmine and pilocarpine in terms of activity for this particular disorder is that in pilocarpine, the use is a bit, or the effect of it is a bit shorter lasting, and it's also not as well tolerated because it can cause allergic reactions at the site. On the other side, this is a mydriatic agent And you can see here, you see the difference, how the pupils are blown out really large. This comes from a mydriatic, means that you're dilating the pupil. This is from Atropa belladonna in the nightshade family, another alkaloid. It's an atropine, which is a tropine alkaloid. And traditionally, as in the Mediterranean, women would also apply the juice of the berries from this plant and other parts of the plant to their eyes to purposely dilate your pupils. What happens when your pupils are dilated? Who's ever left an eye exam after your dilation? What happens? Super blurry close up. Are you sun sensitive? Yeah, because there's just so much light coming in. This was used historically, though, not for eye exams, but rather to mimic sexual arousal in women. So it was a way of, it was a beautifying, cosmetic agent. If you have these big pupils, it's like, mimics what you look like, I guess, during sexual arousal. So they would add that to their eyes intentionally as a beauty agent. That practice, as far as I know, is no longer in practice today. From a medical perspective, eye drops and ointments have been used they use this drug to treat, to open the iris for eye exams and surgical procedures, and also to treat anterior uveitis. You know, uveitis is anything with itis means inflammation of or disease of, and this is the uvea is kind of a tissue layer within the eye. It's about as detailed as I think you guys need to know. So it's inflammation of a piece of flesh inside the eye. Okay. All right. For ocular pressure, we have another alkaloid. In this case, it's cocaine, and this is a mydriatic as well, and it can help to reduce ocular pressure. Sometimes it's used in combination with atropine and epinephrine for this purpose. So basically, in these cases, you either have eye medications that are helping to reduce redness in the cases of conjunctivitis, or to help cleanse away the grit and grime or pus from an eye infection, or they're being used to constrict the eye, or constrict the pupil, or they may be used to dilate the pupil. Those are kind of the main ways that we've used plants to treat disorders of the eyes. Now let's move on to the ears. If you've ever had an ear infection, and many people do as children, there are different levels. There's an inner ear infection, or otitis interna. You can have symptoms of vertigo that can last, and vertigo is basically when you're sitting, you feel imbalanced, like you're on a ship, and you can have risk of falls and things. You don't have a good sense of your balance there. Otitis media is a middle ear infection, and this is associated with a lot of fluid and pressure. You can also have fever with this, and then you have otitis externa, which is inflammation of the outer part of the ear canal. And this could be due to infection or even eczema. Some kids will present with eczema around the ear, on the outer ear. The most painful ones, though, are really that otitis media, where you have a lot of that fluid pressure buildup that we currently treat with antibiotics. And here's a comparison of, here's the eardrum, and then you have this fluid pressure buildup around the eardrum that causes a lot of pain. And this is how the way this begins is this tube here actually goes into the throat. And so bacteria can actually make their way up into that space and cause those bacterial infections of the eardrum, or the middle ear. Another cause of ear problems is excessive cerumen, or just a lot of earwax, or earwax that becomes hard. The oils alone can be used just for softening the cerumen. So if you have hard buildup of wax, it can cause problems in the ear canal. So this may be added to help soften that. These are good because they're rich in these triglycerides and fatty acids and glycerides, and so used both for softening and also kind of helping to remove that hard buildup of wax in the ear. And again, to make that a treatment for ear infections, they're adding these antimicrobial medicinal plants, and those differ based on wherever the people live, because you have different plants that have these activities. Now, for oral and throat infections, there are a number of remedies that often will involve gargles. So I've seen even people use very poisonous plants that may be gargled and not swallowed. These are not poisonous. You could swallow them, but they're often used when you have the pure diluted oils. These can be gargled. So you have thymol, which has anti-inflammatory properties, antiseptic, meaning it has antimicrobial properties. It also improves the smell of the breath when you gargle with this. We've talked about peppermint oil and really menthol here, again, acting as a deodorizing agent and as an antiseptic. And then salvia or sage helps to soothe inflammations of the mouth and throat. So all of these have some overlap in their chemistries. You're going to have a much higher level of thymol and thymus species, but you're going to see some similarities in the levels of some of these aromatic oils across the Lamiaceae family. So now we're going to move on to the endocrine system. So let's talk about the endocrine system. So we're going to talk about hypoglacemics. We'll talk a bit about phytoestrogens. There were some reading assignments that you were given for this part of the lecture. We'll go over hormonal imbalance in women, weight loss, benign prostatic hyperplasia or BPH, and then sweeteners and taste modifiers. So hypoglycemia is the condition that occurs when you have levels of blood glucose drop below normal. You can have, in cases of diabetics, it can be a side effect of insulin taking effect as you get your new insulin injection. But also, if you've ever skipped or delayed a meal, you can feel this drop in blood sugar. Now, hyperglycemia is when, on the other hand, your blood glucose is too high. And we normally have insulin, which is a hormone that is made in our pancreas to help modulate levels of glucose in the body. So insulin works to convert glucose to energy, ATP, that can be used by our cells. There are two types of diabetes. The type 1 diabetes usually occurs in children and young adults. And then type 2 diabetes is more common and is, again, tied to dietary choices in many cases. And this is something you can develop at any age, but is most common in your late 40s. And it's affiliated with like obesity, lack of physical activity, and so on. There can be genetic factors that also can make you more predisposed. So when we think about botanicals for diabetes, I think Matricaria carrantia is probably the one that I've seen the most research on to show that it has some nice hypoglycemic activity that can be used and is used in traditional medicine for diabetes and kind of people that are at the risk of becoming diabetic. Okay, so who here has had Matricaria carrantia or bitter melon as a food? Anyone want to describe it? Let's see. Well, first, how did you prepare it? How did you prepare it, Ryan?
Well, my roommate is Taiwanese, and she just, puts it in a stir fry.
So she stir fries it with, an oil base or something? Or?
I'm not sure what she put in it. I just ate it, but it did seem kind of oil-based.
Mm-hmm. Anything else?
Boiled.
Boiled, okay. Steamed. What else? Raw. Ooh, brave. It's bitter. So what does it taste like in all these different formats? It's pretty bitter, right? It's a very bitter. I think bitter is an interesting flavor we don't spend enough time exploring. There's a lot of delightful things in bitter foods. But yes, it is very bitter, hence the name bitter melon. It looks a bit like a cucumber that's wrinkly. The compounds that are present include these triterpenoids, and it has polypeptide P, which is an insulin-like protein. What's interesting is there are a number of mechanisms that scientists believe are having or the reason for why this is working as a hypoglycemic. It is used as a regular food or can be used as a medicinal food in people that might be at risk of this. In addition to cooking it in all these different ways, you can also make teas of it to consume as well. Now we're going to jump over to women's health. This is based on a lot of work that's been done at the University of Illinois, Chicago, where they've studied a number, the plants that women use in different cycles of parts of their life. So there are Now, this does not necessarily mean that all of these are completely clinically relevant. This is based on actual consumption data. So amount of plants that are used according to dietary supplement sales by age. So you have Vitex being used or very hot, very earlier in life, so treatment of PMS or management of PMS. You have UTIs and cranberry, ginger during pregnancy, also milk thistles taken a lot by pregnant women, black cohosh for menopause, there's red clover for osteoporosis, and then soy and hops are also being used in chemo prevention or helping as a cancer preventative. So these are, again, based on overall purchases of these being important during life. And these are also tied to overall estrogen levels, which decline as you age. And so for definition, menopause is what happens which marks the end of your menstrual cycle, and it's diagnosed after you've gone at least a year without a menstrual period. You have a number of symptoms that are associated with menopause. Women have complaints from the appearance of irregular periods, vaginal dryness. One of the most common ones you hear about is hot flashes, chills, and night sweats, difficulty sleeping. There are a lot of hormonal changes that happen in this stage of life. You have this health report that was released in early 2000s that has changed the way that we approach this. Before, women were being prescribed traditional hormone therapy, but this hormone replacement therapies have also been linked to a number of different diseases ranging from breast cancer to cardiovascular disease and stroke. And so because of these higher risks, there's been a turn towards the use of more botanicals, or at least an interest in botanicals among the public to manage these symptoms. So these are some of the more common plants that are used as sources of phytoestrogens in the diet. So you have, we mentioned before, soy or glycine max. You have red clover. This one you guys should be familiar with, kudzu, right? This is an invasive species here in Georgia. And so there have been a number of clinical trials where they have treated women with these isoflavones derived from plants, especially soy has been one that they've investigated a lot of. Now, some of the results from the soy trials have not been conclusively positive, and this is thought to have something to do also with the limited bioavailability of the main soy isoflavones, which are ginseng and daidzein. And that might explain why we're seeing modest effects, because in the laboratory you can see one thing, but when you put it into an actual human being, the outcomes are a bit different. But let's talk a bit about soy. Soy is a major source of protein in Asian diets, and now we're seeing it's emerged more and more so also in the West. Also used heavily, of course, in animal feed. You have these isoflavones are hydrolyzed in the intestine, meaning that you have a larger structure with a sugar unit that is then cleaved off, leaving the aglycone unit, which is ginseng and daidzein. Now, you have, again, I mentioned the clinical studies. There is a Cochrane collaborative report on 43 randomized controlled trials. Cochrane reviews are comprehensive reviews of numbers of clinical trials where they're testing whatever this drug or intervention is. And so it takes all the data and does a really rigorous analysis of what can you conclude from all these clinical studies. And their conclusion was you can't conclude anything from these clinical studies. There was no conclusive evidence that soy supplements reduced menopausal hot flashes. Now, do women still take soy supplements and consume soy products for the hope of that? Yes, they do. Because, again, the science and market are not always well aligned. Red clover is another really popular supplement used, again, for managing menopausal symptoms. You have these isoflavones known as biocanin A and formaminotin. And these are actually, interestingly, degraded by enzymes in the intestines and liver to become what? Again, genistein and ditazine. So these plants are both in the Fabaceae family or the bean family, and they have some similar chemistries as I just showed. Now, what's interesting is that there is some data that suggests that red clover isoflavones may have better bioavailability compared to soy. But again, if you have pure genistein and pure datazine, those are the same compound, it doesn't matter where it comes from. But the difference here is they're coming in different precursor forms, whereas in soy, it's in a glycosidic form. Here it's in a different form of these proestrogens. There is a trial that was done on 72 women that were given randomized doses of 40 milligrams of dried clover, and there was a significant reduction in symptoms measured by the menopause rating scale. However, that's one study. Here's our lovely kudzu, which covers the sides of all the trees as you drive down the highway in Georgia. Also in the bean family, right? So you have, again, some of these similar chemistries, and guess what is happening here? You have another starting material in kudzu. It's a compound called purin. But again, once it gets into your gut, it's metabolized into datazine. So we're talking about the same chemistries coming from, somewhat similar species, or at least they're in the same family, but they're making these same isoflavonoids. A trial with these, looking at 127 women, showed that taking 100 milligrams of isoflavones showed no significant changes compared to the control. So now let's move on to men's health, and let's talk about benign prostatic hyperplasia. This is not prostate cancer, just to be clear. Benign prostatic hyperplasia is a condition in which you have an enlargement of the prostate. So if you think about the anatomy, you have the prostate, here is the bladder. And what happens is as men age, this prostate can become enlarged, and what's happening to the tube going from your bladder into the urethra? It's becoming smaller, and that also takes up some of the space of the bladder. What happens here is you have symptoms of men not being able to clear their bladder. So if you've ever seen these commercials where the guy has to go pee and it's like drip, 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 you're never ever able to fully void the bladder. And so this is disruptive for sleep. It's disruptive for being able to really have a normal functional day because of the difficulty in beginning urination and also dribbling during urination and having that weak urine strength, like you're not able to force out the urine. It kind of comes and stops and starts. And this, again, can be really troublesome at nighttime. So let's talk about the solid palmetto fruits. These have been, this is probably one of the major supplement plants used to treat BPH. There are a number of high-quality clinical trials that show that there's no difference over this versus placebo. Now, I also want to say that sometimes the way that these are being prepared as supplements might not be parallel to their preparation that you would see in a traditional medicine format. But just as a bit of context, this is in the palm family or the Ericaceae family. If you've ever been to South Florida and you see these low-laying palms and these oak hammocks, if you're ever familiar with this kind of landscape, these are the solid palmetto fruits. So you have these they turn dark purple when they're ripened. The reason that people got interested in this is because there is a history of Native American use for genital and urinary disturbances. But it's not clear, again, if this is actually something that's effective for BPH in particular. However, this does not stop it from being sold. It is a wild harvested medicinal plant. No one grows and farms this. Instead, what happens is you have people that will come out and pick on private lands, often cattle lands in Central and South Florida, which are used for just kind of wild landscapes for grass grazing cattle. And they'll have teams come out and pick these from the wild. And then they'll be brought to a place for processing. Okay. The other thing that is interesting when it comes to thinking about endocrine system management is how we can use different plants as substitutes for sugars or for sweeteners. We know that heavy consumption of glucose in our foods, and again in the U.S. we have a very sweet diet compared to the rest of the world. It's in just about everything that we consume, from your ketchup to your drinks to your juice. There's been a long-standing interest in finding natural products that could act as artificial sweeteners to get that brain boost of interpreting that you have something sweet and high energy, but without the actual consequences. So this is kind of the golden egg when it comes to the beverage industry in particular. There also are interest in chemical taste modifiers, or things that could perhaps reduce the bitterness or in some way stimulate some of those other receptors like anti-sweet, sweetness-inducing abilities. So we're going to start first with Stevia rebondiana. It's also known as stevia. I have the plant itself. And again, this is from the leaf. Now, these contain what are called steviol glycosides. What's interesting is that these are actually sweeter by 250 to 300 times sweeter than sugar, or than sucrose. Take a little pinch and put it on your tongue. Let's see what happens. This is what the plant looks like when it's fresh. You can grow it easily in a container. You also see that stevia leaves are often added in tea blends. So if you look at these blended teas, you might have green tea with natural sweetener. They'll just throw some of this leaf in there, and it gives you a little bit of that extra sweetness to it. So if you like sweet tea, or you like to have sweeter herbal teas, this is something nice to add to it. What's interesting is that this has also been tested. The compound, these steviosides, ribondicide A and B, or A and C, are the major sweet compounds. In a little while, we're going to have some stevia powder that's sold in the store. Who here has used steviol or stevia? Like, what does it look like when you open it up? The white powder to make you think that you're using sugar. Now think about this for a moment. This is 250 to 300 times sweeter than sugar. Do you think they're giving you pure stevia compounds in that packet? No. They actually will bind it to a kind of a carrier. Sometimes they use dairy proteins as kind of that white powdery look, to then get the dosing right, because it's so intensely sweet. Now, how many of you have a bitter taste in your mouth? I see a lot of you are drinking water now. Yeah? That's the downside of stevia. This is why this was not the golden egg. Because after you consume it, you have that intense sweetness at first, but following consumption, there's a bit of a lingering, bitter aftertaste. Okay? Which is something we don't experience when having sugar. Now, the nice thing about this is that you're not getting the kind of caloric load that you would with a sugar, okay? Because it's tricking your receptors. And the way it does, they've actually worked out the binding pocket with the molecule to show where it binds into these sweet taste receptors. Now, the advantages are that if you are in a very sugar-reduced diet, something like stevia can add a little bit of sweetness to your life, right? Now, let's go to another one. This is another interesting plant. And if you take my food class in the spring, we do a full taste experiment with this plant. So I only do it in one class. Like this class gets the kava tasting, that class gets the miracle berry tasting. So it's the incentive to join. How many of you have had miracle fruit, or how many of you have been to a flavor tripping party? Right? So what was it like? And so basically, this is a plant that originates in West Africa. Where in West Africa, you have a diet that's heavy in very acidic, sour, fermented grain porridges. So sour porridges. What's interesting about this particular plant is that when you take the fruits and you kind of slightly crush the fruit in your mouth, there's a seed inside, you're going to crush a little bit in your mouth, and let it roll over your tongue. You kind of want to have it on your tongue for a bit. Let it sit there. After a while, and it doesn't really taste like much initially, but then after a while, you start to feel this sparkly feeling on your tongue. And it starts to become very sweet. That's because the acidity of the fruit itself is activating itself. Like so, the way that this works is there's a glycoprotein called miraculin found in the plant. And at low pH or acidic pH, which is the pH we see in sour foods, you have this acidification changes the topography of your taste bud. This binds, and then when you have that high acidity, it binds into that pocket, and you basically have activation of your sweet receptor. So it tricks your tongue into sensing sweet, even in the absence of any sugar. And it does that again through acidity. So why did you not have a great experience eating the bag of jelly beans? They weren't acidic enough. If you had taken lemon drops, perhaps, or a fresh lemon, I have to tell you, a fresh slice of lemon after you've let it sit on your tongue, it's like eating the most delicious lemon dessert you could ever imagine. It's amazing. Sour cream tastes amazing. Who likes to drink apple cider vinegar for your health? If you take this beforehand, it will make it beautiful and sweet, like a nice juice, until it hits the back of your throat and it burns. Because this only works on the tongue. It does not work in the rest of your body. It's not affecting your brain in that way. So when you have that taste of vinegar hit the back of your throat and you feel that burn, this isn't going to take that away. If you have it with just normal foods, and you can do taste experiments trying lots of different foods, you'll have different levels of sweetness that are activated. Now, this is in the endocrine lecture because it is important to, when we think about alternatives to sweeteners, why do we not see miracle fruit packets like we do with stevia? Why has this not made it big time? Why is it kind of confined to the flavor tripping kind of food trick event space and not like grandma is having her dessert with miracle fruit? Number one, would it help if we put miracle fruit into a food on its own? Think about its mechanism. We need to coat the tongue with it and let it stay there for a bit before it starts to activate. Then you have to eat a food, and it has to be a sour food. It has to be an acidic food. So maybe there's a way if you took like a miracle fruit lollipop and had it sit on the tongue, then you pair it with a certain sour food, maybe that would be like a specialty dessert, but it's not going to be good for adding, for example, to your tea or to your coffee or to any other place that we usually put, or to your smoothie, places where we usually put sugars or sugar sweeteners or artificial sweeteners. Here's another important one that has a long history of use with the Khoisan people in South Africa and Namibia. So this looks like a cactus, right? Is it a cactus? Is that a cactus? Apocinaceae is not a cactus family. It's a succulent family, not a cactus. Okay? So when Hoodia came out as the next new fad for weight loss, can anyone guess what happened on the internet? Well, you would go to websites and say, well, I'm going to order a Hoodia. You can grow it at home. They'll sell it to you, and you can nibble on it to help you lose weight. You can have the actual plant. But what were people actually getting shipped? Were they getting shipped Hoodia? All kinds of crazy cacti. And so what are the risks there? You have someone that's trying to lose weight who wants to eat this plant intentionally as part of their regular diet. What's the risk there? You have unknown species. We don't know if those are edible. Are they safe? Were they actually all cacti? Some of them may have been euphorbs or other Apocinaceae. That, by the way, Apocinaceae and euphorbs can often be very poisonous. And so it's another example when something that's from a traditional culture then makes it to this market scheme and can cause a lot of problems. Anyhow, there is a glycoside, this pregnant glycoside, that may play a role in the hunger suppression activity. The thing about Hoodia is much like you see in the Andes with the chewing of coca leaves, people chew coca leaves not to lose weight. They chew them as a stimulant and to help suppress hunger and ease altitude sickness. In the desert regions of the Cedarburg, which is kind of in the Western Cape going up into Namibia, you have these beautiful dry deserts. It's one of the best bouldering places in the world if anybody climbs. But you have this very arid environment, and so when you're going on a long hunt, having a plant that's available in the wild that you can snack on that helps suppress your hunger on this long hunt is very useful to them. It's never used to make them lose weight. But that's how we translate it into this Western market of interest here is to suppress hunger. They still don't know the mechanism of action. It's thought that it might act on the hypothalamic receptors. It was developed as a food ingredient for weight loss, though, because of this hunger suppression, and it has a market size of over $3 billion. Again, the concerns, there's no clinical evidence of appetite suppression. There's no clinical evidence that leads to weight loss. And again, adulteration of products is a big, big problem. Now, for the Khoisan people, this is part of their cultural heritage, and it's also part of, you know, their hunting kind of traditions, and you know, is useful for them. But I don't see it being useful on a larger scale because we're distorting its actual applicability. And because of overharvesting, now the populations are also seriously threatened.